Hi, my name is Dr. Michael Goss from the Animal Hospital of Ashwaubenon. When you bring your pet in for its yearly checkup, one of the most important aspects for us as veterinarians is the physical exam. Now, every veterinarian performs a physical exam a little bit differently, but I'm going to show you how I perform it and what I'm looking for during the exam. Now, I usually start at the head and work my way backwards. I always start out with the ears, and I'll look down the canals and I'm looking for any signs of redness, debris, inflammation, anything that would indicate the possibility of an infection. If there's an infection, I would swab the ear and check. Next, I go to the eyes. Again, eyes are very similar. I'm looking for redness, I'm looking for debris, I'm looking for any squinting, anything that would be abnormal. If there's something abnormal, I would perform an ophthalmic exam, which I'm not going to do here, but that would just give me a little bit more detail as to what's going on with the eye. Next, I will do an oral exam, checking the teeth. I'm looking for a number of different things. I'm checking the gum tissue for signs of redness or gingivitis. I'm looking for tartar buildup. I'm looking for abscess teeth. If I see anything abnormal, the next step would be to have a dental cleaning done. Then I will check peripheral lymph nodes. I'm just making sure that all the lymph nodes are not enlarged and that they're normal size. Next, I will move to the chest. Now, the first thing I do is listen to the heart. When I'm listening to the heart, I usually will get a heart rate, and then I'll spend a little bit of time listening for any murmurs or arrhythmias or anything that may be present. Once I'm done listening to the heart, I will listen to the lung fields. Now, the lung fields are a fairly expansive area that we're listening to, and I'm going to kind of abbreviate it here. I usually listen a lot longer, but we're just listening for abnormal sounds when we're listening to the lungs. Next, I will move to the abdomen, the belly area, and I will palpate the abdomen. When I'm palpating it, what I'm looking for are masses, pain, anything that the dog would resist while I'm palpating. The next thing I will do is examine all four limbs. Now, what I usually will do is kind of start at the bottom, look at the pads and the nails, and then I'll work my way up each individual joint. I'm only going to do one leg in this particular video to keep it short, but this exam is important, especially in older pets, when we're concerned about the possibility of arthritic changes that can be going on. It's also important in young dogs who are limping due to some sort of soft tissue injury. Next, I will look under the tail, look at the rectal area just briefly to make sure there's nothing abnormal. The last thing I do is do an expansive search of the skin. What I'm looking for is redness, hair loss, signs of any infection, anything that would be abnormal. So I usually will start at the neck and kind of work my way through, and then the last thing I will do is feel everywhere to check for masses. Skin masses are very common in pets as they age. And a lot of those have to be dealt with, so if we do feel anything abnormal, we would check into that with more detail with the physical exam. So at the Animal Hospital of Ashwaubenon, our goal is to provide the best quality care for your patient as possible, and the first step in that is the physical exam. Thank you for watching this video. Again, my name is Dr. Michael Goss from the Animal Hospital of Ashwaubenon.